Mr. President, I did a mathematical calculation a couple of years ago, and it resulted in an interesting conclusion. The Senate is a rural body. 18 members of the United States Senate represent a majority of Americans. That means 82%, or 82 out of 100 senators, represent smaller states, more rural communities. And I want to talk today about a disastrous development that is headed for our rural communities that we have the capability to fix, and is one that we should sooner rather than later. I'm talking about federal funding for federally qualified health centers, which expired on October 1st. 70% of the funding for the FQHCs expired on October 1st. 100% of the National Health Service Corps funding expired on October 1st. These are vital programs that serve rural America and provide incredibly important health care services. They're an overlooked part of our national health care system, in part because they are traditionally in rural and outback locations. In Maine, we have 20 centers. We have 20 centers and 70 facilities scattered all over our state, and they are providing services every day to over 200,000 people. This is a vital part of our healthcare system, and yet the funding expired at the end of September, and so far nothing has been done. How important is it? 1,700 employees at these facilities, a local economic effect of over $300 million a year, $8 million in state and local tax revenues, $32 million in federal tax revenues. They provide $16 million worth of uncompensated care that goes to Maine people who need the help. They're efficient. They've saved Medicaid over $100 million in Maine. $257 million is the estimate for what they have saved the overall health care system. Again, 1,700 jobs, 1,000 more jobs located in their communities. But this isn't only about economics and economic development and jobs, it's about health care. 1 in 6 people in Maine get their health care from FQHCs. 210,000 people. They accept everybody that comes in the door. I've been to them all over the state. They use a sliding fee scale for people that are low income, who don't have insurance, and they provide all manner of services. They have, it depends on the center. Different centers have different services. They have medical, behavioral health, dental, substance abuse, treatment and support, case management, optometry, podiatry, OBGYN, prescription assistance, outreach and enrollment, pharmacy, radiology, school-based healthcare services. These are the healthcare providers for rural America. And it's not only Maine, it's across the country. 10,000 sites across the United States, 26 million patients at risk. Well, what's the big deal? The big deal is people are going to lose their health care services. We estimate that in Maine, we're going to lose about 400 clinicians, administrative and support staff will have to be laid off at the beginning of the year unless we solve this problem in the immediate future. At least 25 of these sites will be forced to close. And we believe that there will be almost 30,000 Maine residents who will lose their access to their health care system. Most of the health care FQHCs, federally qualified health centers, are getting by on their funding from last year, so the shortfall of the expiration of the funding hasn't hit them yet, but it will begin to hit them on January 1st, and that's what we have to respond to. It also is already having an effect just by creating uncertainty. I got an impassioned letter from the leader of one of our centers in Maine about the fact that they had been very diligently recruiting a dentist to come to their community. Dentists are very hard to come by in rural America. They had one that was ready to come, and then suddenly they heard about the uncertainty surrounding the funding, and it may or may not come through, and that dentist is now reconsidering their decision to come to this Maine community. That's a tragedy. That's a tragedy for the people of that town where these services are literally not available. So, what does it matter? It matters because we're talking about people losing their health care services. This has never been a partisan issue. I don't think there's a heck of a lot of debate around here about the importance of FQHCs and that we need to get them refunded. In fact, the presiding officer and Senator Stabenow have sponsored a bill, the CHIME Act, that would resolve this issue. We just need to get it on the floor and get it done. We proved today by the passage of the National Defense Authorization Act that we can take major issues, bring them to the floor, and move them forward, especially those that aren't particularly controversial. But my concern is, even though there doesn't seem to be controversy, it's just not happening. And now our centers are having to make plans for layoffs, for closures, and for closing their doors to the people that need the care. This is something we can do, Mr. President. This is something that we can resolve. It's within our power. The legislation is ready to go, and we should get this done. If we're leaving today for the Thanksgiving holiday, but if we leave at the end of the year and haven't done this, it will be a tragedy for rural America. It will be a betrayal of rural America. It will be a betrayal of our constituents. And all of us have been to these centers and seen the care that they provide, the caring that they provide, the passion that the people bring to the services in their communities, and how much they mean to their communities. This is one of the best federal programs ever created. And it's always been supported on a bipartisan basis. And so I urge my colleagues today to prepare ourselves to get this done as soon as we possibly can when we get back after Thanksgiving. We have so much to be thankful for, and I want my people in Maine to realize that they can be thankful for those health centers that make so much, that are literally a lifeline in their communities, that mean so much to them. And I believe this is something we can and should and will do. Thank you, Mr. President, and thank you for being a leader on this issue. And with that, I will yield the floor and suggest the absence of a quorum.